namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And thank you again for joining us here today. And you know where you can go to get all of the latest podcasts, hotzepodcast.com. That's HOTZE podcast.com. And so today what we have on tap is to talk to you about the state of your heart health, how you can optimize your heart health, and maybe if you all are in a higher risk category, what you can do to get your heart back to where it should be. Dr. Hotze, why don't you speak to us about that?
Thank you so much. And heart disease is the #1 cause of death of Americans. There are about 600,000 people die each year of heart disease, which includes heart attacks and strokes and congestive heart failure. There are about 600,000 die every year, half the number of men and half women. Men tend to have their heart problems at a younger age than women do. Women tend to get their heart conditions after they've gone through the change of life. So there's some protective effect with female hormones and heart disease. Heart attacks is what I want to talk about today, because heart attacks, which can lead to congestive heart failure, heart attacks are a preventable medical problem. That's right, it's preventable. Well, you go, how in the world, what causes it and how can I prevent it? Well, it's important to understand what causes coronary artery disease, which leads to heart attacks. The coronary arteries are the arteries that supply your heart muscle with blood. And you've got the left anterior descending artery, the right circumflex artery, you've got the main coronary artery and the circumflex artery, among others. And these arteries carry the blood supply, which then feeds into the all the branches and into the capillaries that feed the cells the nutrients and the vitamins and minerals and hormones that make the heart muscles function and produce energy so they can contract. Well, when there's inflammation in the body, inflammation often settles first and foremost in the coronary arteries. They become inflamed. Now, this can be caused by all the chemicals that we're exposed to in the environment. They're toxic. Whenever we're exposed to toxins, it causes inflammation. So there are things we breathe in the air that you can't help. You just breathe in the air. Certain substances and chemical products in our food, in our drinks, and in the lotions we slather on our body. And women are a lot worse than men about putting all these lotions on their body, which are filled with petrochemical products derived from oil, and these are dangerous substances that are very toxic in the body, and they cause inflammation. Other things that cause inflammation in the body are certain heavy metals like mercury that you have from your amalgams, or lead, or aluminum from cooking in aluminum cookware, or drinking out of aluminum, drinking your soda water out of aluminum.
Oh, a can.
Mm-hmm. So you got the exposure to heavy metals. You've got infections that can cause inflammation. So when people have recurrent and chronic infections, whether it's sinus infections or bronchial or skin infections, or whether you've any kind of infection, teeth infection particularly bad, because they're so indolent and they last such a long time. Another thing that's really bad is when you have a tooth canal. Tooth canal is a source of infection because the tooth canal that created has no blood supply to it, and the bacteria will grow, and they'll be in that decayed tooth where the nerve root has been removed, and they'll grow up in there, and they'll put off chemical toxins, which can adversely affect and cause inflammation in your coronary arteries. So the body has, and the other thing is you're eating what you're eating. So people that eat fried foods have trans fatty acids that we find in the salad dressings or in margarine. This is when we say they're trans fatty acids, that these trans fatty acids are man-made, and they're made for shelf life. and they're very harmful, and they create inflammation in the body. So we don't want to consume those. And a simple carbohydrate diet, it yields sugar, high levels of sugar in the body, and that has causes an inflammatory process in the arteries and in the body. So we want to remove the inflammation. If we have inflammation in the coronary arteries, they will begin to deteriorate, because the coronary arteries, you think about it, they're on top of that heart, and the heart is beating 72 times every minute, and 72 times a minute, and it's beating 100,000 times a day, and that's stretching that artery that's already inflamed and deteriorating. So the body wants to heal that, and the mechanism primarily by the body is to lay down a protein lining called collagen. Collagen is the protein glue that holds all our cells together. So if you don't, it requires vitamin C. Vitamin C is required to make collagen. Just so happens human beings don't make vitamin C like all the other vertebrates, all the other animals that have backbones in God's creation, including all the other mammals, with the exception of 3, monkeys, guinea pigs, and there's a bat. Don't make vitamin C. All the rest of the mammals do. That's why they don't get heart attacks, because their arteries don't become inflamed, because when they make adequate amounts of vitamin C, then they can make adequate amounts of collagen, which line the arteries. And so that's, if you want to prevent heart disease, first and foremost, you need to take copious amounts of vitamin C. And the average animal makes 1,000 milligrams of vitamin C per 25 pounds of body weight. So we'd recommend vitamin C as the first, and it really is. It's a wonderful vitamin. And there are literally tens of thousands of articles in medical journals dating back into the 30s and 40s of the last century about the marvelous benefits of vitamin C, especially when taken in high doses. So vitamin C will help you produce collagen to heal the artery. If you don't heal up those arteries, if you don't have enough vitamin C in your diet, so you're not making adequate amounts of collagen in that area where the inflammation is occurring, the body has a backup mechanism. The body doesn't want that artery to deteriorate and break down. So a substance called lipoprotein A, which is a form of low-density lipoprotein, which is known as LDL cholesterol, is then mobilized and is used as a patch to patch the walls where there's inflammation in the arteries. And then those patches build up a plaque of gooey substance, and they begin to incorporate into that plaque calcium. Calcium's incorporated into the plaque, and that hardens the artery. So you get hardening of the arteries, known in medical terms as atherosclerosis, which in Greek, it's a Greek term, athero meaning porridge and sclerosis meaning hardening. So it's a hardening of that plaque, hardening of the porridgey kind of plaque. That's what it's like. And that hardens the arteries, which, if you think about it, is a wonderful mechanism because it provides rigidity to the artery that was breaking down. It provides some stability. Unfortunately, as more inflammation occurs, then we get further and further buildup of plaque and further narrowing and hardening of the arteries and narrowing of the arteries. So then if you have a plaque upstream, it can break off, or a clot can form, and it plugs up the artery, and the next thing you know, you got a heart attack. That's what happens. So the key way to resolve or prevent having a heart attack is to stop the inflammation from occurring in your coronary arteries. So if you want to do that, first and foremost, you got to get on vitamin C. Then you have to put yourself on an eating program that minimizes the amount of sugar and simple carbohydrates you put in your diet, because they're converted to sugar, which cause an inflammatory process to occur, which adversely affects your coronary arteries. So you want to eat healthy. And so we recommend, good healthy oils like eggs and butter and olive oil and fish oil, olives, avocados, good oil in your body. Put good oil in your body. Also eat good healthy green vegetables, and then eat a modicum of meat, a small amount of meat. Don't fry your food. Now, does that mean you never have fried food? Yeah. I think in the last 10 years, I've had fried chicken twice, and I had it once last year and once this year. It tasted mighty good. But I don't make that a regular diet.
No, absolutely not.
It tastes good, though. Fried food tastes so good. So anyway, what you do is you characterize your eating lifestyle by eating healthy. And that's very important.
Well,
Also,
Dr. Hotze, hold that thought, because you outline a lot of this in your latest book, Do a 180.
Right.
And people can always get that. We're offering it complimentary. If you call 281-698-8698, you can get a copy of Dr. Hotze's latest book. So that's 281-698-8698. Go ahead, Dr. Hotze.
right. And some other things that you can, another thing you ought to do, find out if you have any calcium in your arteries, in your heart. Get a CT heart scan. We do it here at the Hotze Health and Wellness Center. And it's always surprising. You should look at people, they look very healthy, but you find out they've got significant load of...
It's a silent killer.
It's a silent... If heart attacks are a silent killer, remember, of the individuals that have their first heart attack, half of them die from their first heart attack. Now, that's 50% of the people that have a heart attack die with that first heart attack. So we don't want to cure heart attacks. We don't want to treat heart attacks. We want to prevent heart attacks. I say it takes about 20 years to cook a good heart attack, 20, 25 years, like putting something in the oven. So we want to prevent it. And the way we prevent it is good, healthy eating lifestyle. Plenty of vitamin C is important. Magnesium is important. It keeps your blood pressure low. Tell you what else is important is vitamin D3 is important on strengthening the heart. In men, testosterone is very important for heart health, as well as coenzyme Q10. Coenzyme Q10 is an energy molecule that's made in the liver, and as we age, we make less and less, but it's very important in the heart muscles to help the development of energy in your power plants within your cell called the mitochondria. Your heart needs a lot of energy, and that's what you want to do is make sure you have adequate amounts of coenzyme Q10 to do that. So these are some things you can do to prevent heart disease. The other thing you can do is exercise. Aerobic exercise can be very, very helpful to making your heart healthy so you don't have a heart attack. So we're going to talk about healthy eating. We're going to talk about good vitamin and mineral support, hormone support with thyroid as well. Thyroid is very important. It strengthens your immune system. It cuts down on inflammation. When you're low thyroid, your body has inflammatory products that it doesn't get rid of very easily because the body's running at a suboptimal energy level. Its metabolism is slower when you have low thyroid. So thyroid is very important. And then exercise. So good eating, replenishment of your hormones, vitamin and mineral supplementation, particularly your vitamin C, and then a good healthy exercise program. These four things can go a long way to helping you prevent having a heart attack. And if you have calcium buildup in your artery, they can go a long way to helping you arrest and reverse that hardening of the arteries.
Great practical advice, Dr. Hotze, and we hope everyone will take that to heart. Yes, pun intended. And one of the easiest things for you to do to take that advice to heart is to give us a call to get a complimentary copy of Dr. Hotze's book, Do a 180, Take Charge of Your Health, Do a 180, Join the Wellness Revolution. And that's 281-698-8698, 281-698-8698. Always a pleasure having you join us here at Dr. Hotze's Wellness Revolution. Have a blessed day.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.